didn't even realize she gave birth because it was so easy. And the doctor was like, "You are my daughter, you are my sister, like we're gonna do this together." And the woman didn't even realize, she heard the baby crying, she didn't realize the baby had come out because it was so pain-free and so easy. And I think that really speaks to how like a community of like engaged doctors and midwives and staff can really build like such good care and can mean so much to people in these hard circumstances. My name is Alexa Copsey. I'm from Hillsborough, North Carolina. I am an English major with a concentration in medicine, literature, and science, and also a medical anthropology major. So this summer I spent 6 weeks in Jordan. I was in a Syrian refugee camp called Zaatari Syrian Refugee Camp, which is one of the biggest refugee camps in the world. At its peak, it holds about 80,000 people. Obviously, with the different changes politically in Syria, people are actually leaving the camp now. But it was a very, very successful camp, opened in 2012. And I was in the Jordan Health Aid and Society maternal health care clinic. So in prior years, they had a labor and delivery unit, they had a NICU. Due to USAID cuts, they no longer do that. And they now are just able to do ultrasounds, checkups, domestic violence care, and also are able to provide reproductive tools like birth control, IUDs, that kind of stuff. So I worked with them. I was conducting a survey with UNC Gillings to study postpartum depression because, like I mentioned, they have psychiatric care for gender-based violence, but they really were not doing anything for postpartum depression. But when we surveyed, we were looking at prevalence sort of retroactively of postpartum depression, and it was high. It turned out to be about 80%. I would do filming some days and interview the women specifically on how the funding cuts and the lack of ability to deliver in the clinic were impacting them. It was very negative. They did not like it, and it violated both legally and culturally a lot of different things that they were used to having. Honestly, my goal was just to make a video that would be accessible to a broader community to see why funding is so important, and hopefully to get labor and delivery back into the camp if possible. That's a big goal. It would cost a lot of money, but I was hoping through my short film of kind of interviewing women and practitioners about their experiences in the clinic, specifically with labor and delivery, that I would be able to emphasize why it's so important. Because I feel like in the US, it's easy to say, like, why is that $10 million going there? We don't know them, that doesn't make a difference. But when you're hearing women's voices, you're seeing their faces, you're seeing their babies, it's a very, very different story.